So today we're going to be doing a screening of the 12 cranial nerves. So the first one's the olfactory, and it's your sense of smell. So to start out, I'm just going to have you close your eyes for me, and then go ahead and occlude one of your nostrils. I'm going to hold up a scent to you, and you should be able to smell and tell what it is. Go ahead and smell.
Cinnamon.
Cinnamon, great. Now go ahead and close the other side for me. Same thing, go ahead and smell.
Cinnamon.
Cinnamon, and one of the two smells equal between the two sides?
Yes.
Good. And if there was an abnormal result, they wouldn't be able to smell anything at all or be able to tell what it is, or the two sides would be different from each other. Next, we're going to go ahead and do your optic nerve. And to do that, first we're going to test your visual acuity. So I'm just going to have you cover up your left eye for me. Then looking out here at the chart, what is the lowest line you can see without squinting?
OHPNTZ.
Awesome, that's 2015. Go ahead and switch eyes for me. Same thing. What's the lowest you can see there without squinting?
OHPNTZ.
Great. So she has good visual acuity. We're also going to check visual fields. And then to do that, I'm going to have you occlude one of your eyes again. So go ahead and include that one. So looking right here at my open eye, I'm going to hold up some numbers on the side and just tell me what you see.
2.
Good. How about here?
5.
Perfect.
1.
Good.
2.
Good. Go ahead and switch eyes. Same thing here.
5.
Good.
1. 5.
Good.
2.
Perfect. Now I'll take that from you. Then we're going to do a color desaturation. So I'm going to go ahead and grab a bottle over here. And go ahead and just cover up one of your eyes. And then looking at this bottle right here, if that was worth $100 of red, I'll go ahead and close your other side. Open. How much would this be worth?
100.
Perfect. So that means there's no color desaturation between the two eyes. And then finally, we're going to check pupils and see if there's an APD and anything else wrong with the pupils. So we go ahead and turn off the lights. And then we'll have this dim light. So all I need you to do is look down there at that target for me. I'm just going to be showing this light in close. Looking at a direct response. Good. Great. Now come do other side. I'm going to look for consensual response. I see it. Consensual there. Now I'm going to do swinging flashlight to test for APD. And everything looks really good there. Okay, so normal results for the optic nerve. If anything was abnormal, we'd have reduced visual acuity, restriction of the visual fields, or maybe a positive APD. Okay, and for the next, we're going to test 3 different nerves here, the oculomotor, trochlear, and abducens. And to do that, I'm just going to do a physiological age and test your eye movements of your muscles. So I just need you to keep your head still, and then follow this light wherever it goes with just your eyes. Perfect. We'll just keep doing that the whole time. Great, looking good. Awesome, so the eyes were able to move in all directions, and there was no constriction, so that would be if there was abnormal, it would be able to move up to the side or something like that. The next nerve we're going to test is the trigeminal, and to test the motor portion of that nerve, I'm just going to have you clench your teeth, and I'm going to test the strength of both the masseter and temporal muscles. So right there, the masseters both feel good, and then temporal both feel strong. So if it was abnormal, one side would feel stronger than the other on either masseter or temporal. Now to do the trigeminal nerve again, and this time do the sensory portion, I'm going to have you close your eyes, then I'm going to touch different parts of your face and just tell me every time that you can feel a touch. Good.
Mm-hmm.
Good.
Mm-hmm.
Feel there? Okay. And then again.
Mm-hmm.
Good.
Mm-hmm.
Good.
Mm-hmm.
Perfect. So did both sides feel about the same there? Good. So if there was abnormal for this one, it would be either one side feels different than the other, or that they didn't have any sensation at all on one side of the face. Okay, so for the next one, we're still going to do the trigeminal sensory proportion, but we're also testing the facial motor portion of this by having the cornea sensation. So I'm going to have the patient look up and away from me, so look up and over to this side. And I'm just going to come in from the side and touch the cornea lightly with a cotton wisp. Okay, and the patient blinks, so that's a positive response. I'm going to come up and away on the other side, same thing. Okay, and the patient blinked again, so it's positive. If there was abnormal, the patient, I would be able to touch the cornea and the patient would not blink at all. And now, again, we're still doing the facial nerve, the rest of it, and so I'm just going to have you go ahead and raise your eyebrows for me. Good. And then smile, and then frown. Okay. And then puff out your cheeks. And I'm just going to test them there. Good. And then go ahead and close your eyes real tight. I'm going to try and open them. Good. Perfect. And so those were all good responses. If there was abnormal, I'd be able to open her eye or push in her cheek, or there'd be asymmetry in the frowning or smiling. And also just during normal conversation over the course of the exam, you can tell by looking at their face if there's anything different between asymmetry between the two sides. Okay, so the next nerve we're going to test now is the vestibulocochlear. And to do that, it's kind of like a hearing test. So what I'm going to have you do first is just go ahead and close off one of your ears. And then I'm going to hold my hand at about an arm's length away and just make a noise with my fingers in a second, and then she'll let me know whenever she can hear it.
Hear it.
Good. So she heard about an arm's length away. If she didn't hear it then, I would move it closer until she could hear it. Now I'm going to go to the other side, so go ahead and close off that ear for me. Same thing, let me know whenever you can hear it.
Hear.
Good. So that was arm's length away again. So since they were equal, that's a normal result. If they were abnormal, it would be I would have to bring one hand a lot closer before she could hear it. And then also for the vestibulocochlear, we can do the Weber test, which we use a tuning fork here. And I'm going to place it in the center of her forehead once I start it, and she'll hear it in both sides and see if she can hear it equally in both sides. So we'll go ahead and do that. So do you hear it
Mhm.
both sides?
Mhm.
Is it equal?
Yes.
Perfect. So that was a good response there. And then if it was abnormal, it would be different in both, and one side would hear it louder than the other. So another test for the vestibulocochlear is the Rhine test, and that's going to be each ear individually. And I'm going to start the tuning fork, hold it against her mastoid process, and then as long as she can hear it, and then to where she doesn't, she'll let me know. And then I'll move it to in front of her ear, and then if she can hear it again, that'll be a positive test. So go ahead and start this one. So I'm going to hold it against the muscle first.
I don't hear it.
Okay, don't hear it.
I do hear it.
Hear it there. Good. So that was a good result. And I'm going to go ahead and do it on the other side. Start it again. Hold it against the bone.
I don't hear it.
Don't hear it.
I do hear it.
Hear it. Good. That's a perfect response. And that's what we're looking for. If it was abnormal, it could be louder when it was against her bone, and she wouldn't be able to hear it in the air. And then if that happens, that means that you have conduction loss. Now we're going to test for the glossopharyngeal and vagus nerves. So to do this, I'm going to have you open your mouth and say "ah" here in a second. And while I'm doing that, I'm looking at the soft palate and pharynx in the back to make sure it rises equally on both sides, and also looking at the uvula to make sure that it doesn't go to one side and stays at the midline. So go ahead and open your mouth and say "ah." So that looks good. Uvula stayed right in the middle, soft palate rise equally on both sides. If there was an abnormal, like I said, it would be asymmetry between either side. Uvula could go to the side, and that could mean that there is a unilateral paralysis on one side. Okay, and now I'm going to look at the spinal accessory nerve, and that looks at the muscles, the trapezius muscle on her back, and then I'm also going to ask her to shrug her shoulders against the resistance of my arms. So I'm just looking for any asymmetry or anything with that. So go ahead and shrug your shoulders. Perfect. So there is equal resistance in both shoulders against my hands, and then that is a normal result. An abnormal result would be an ipsilateral drooping of the shoulder where one's lower than the other, or difference in resistance between the two. So the final nerve we're going to test is the hypoglossal nerve, and then to do this I'm just going to have the patient stick out their tongue. Good. And I'm looking, go ahead and put it back, and then I'm looking for asymmetry, which between either side, and it looked like it came out right on the midline and stayed midline, didn't go to one side or the other. Now also go ahead and press your tongue against the inside of your cheek. Good. I'm going to press against this. Good. And then on the other side. Perfect. And so both sides felt equally there, which is a normal result. Abnormal would be a deviation from one side to the other while looking at midline, and then abnormal on the cheek would be where one didn't feel as strong than the other. And that's a screening of up to 12 cranial nerves. Thank you.
You're welcome.